Hello, everyone, and welcome to CE Institute. My name is Selena Belisle, and I am the founder and one of the board approved CE providers here teaching myofascial release. Now, as a continuing education provider, we primarily teach to people who are already licensed healthcare professionals because this is continuing education. It's following on rudimentary education where you've probably already learned contraindications, precautions, infectious disease, pathology, and so forth, so that you can rule out you're doing no harm between yourself and your client with hands on practice and healthcare. And massage and myofascial release is considered to be part of healthcare. So please do not practice or attempt to practice these techniques unless you're licensed to do so. Now, what I'm going to show you today is a myofascial technique that we call the clock technique. And that's moving fascia in all different directions to determine where myofascial work should be applied and what direction. It's looking for restrictions to know where to work in our hands-on applications. So let me show you what this hands-on instructor demo looks like of the clock technique. If you want to learn more about myofascial applications and hands-on work, it is instantly available to you in our myofascial release hands-on home study classes. If you go to our website, ceinstitute.com, and click on myofascial release, you'll find we teach live webinars, live in-person classes, and home study that's available to you 24/7 instantaneously until your course access expires. After you register, we'll send you an email with that access. So let's get started, and I will show you what a clock technique looks like on two different models. One, a healthy model on the back. Second, a guy who's been in a terrible motorcycle accident and has horrible road rash and myofascial and superficial adhesions. They're moving quite well because we've done a lot of myofascial release on him, but he will always have some type of restrictive soft tissue in that area due to the collagenous scar tissue that developed with the road rash. Until we see you in another myofascial class, we hope you're safe. Here's the hands-on practice.
So this is the clock technique, and I'm going to show you what this looks like on a live person. When I apply my hands here, I'm going to probably do like 3, 6, 9, and 12 o'clock, and we're pretending there's a dial there, and you're going to those 4 different times. I'm going to go clockwise, and then I'm going to go counterclockwise in the same directions to try and figure out in my own head, which way is this moving in a way that I should expect? Which way is it not? Ready? So you're pretending there's a dial over an area. I'm going to start moving the skin right over the muscle, making sure there isn't any adhesion between the superficial fascia and the deeper myofascia. I'm going to go backwards now. Try it again. Looking all over the place. Where is this not moving? And that's how you might apply a clock technique in myofascial release. Let me show you on a different candidate who has been in a motorcycle accident and has massive myofascial and superficial fascial restrictions. Look at that road rash, right? It's a couple years old. This one I'm going to do every hour on the clock. 12 o'clock, 1 o'clock, 2 o'clock, 3 o'clock. You determine wherever you start, right? So we might be starting at 6 o'clock here and then moving at 7 o'clock, pulling backward and moving forward. Okay. And I'm just looking like, where is this moving and where does it feel frozen? Where does the fascia feel stuck? And feel free. It's not just one pass per time frame. You can do 7 o'clock, 8, 9 times if you don't think it's really moving. Even moving with the clock might help release some. You might need more aggressive myofascial techniques, but I'm just kind of over the heart of some of this road rash and seeing where it might be restricted, where movement. And right here, I'm feeling movement. There is no movement, which is why you saw me patter back and forth. So that's the clock technique. Once you determine which way the fascia is not moving, then you'll go into some of the more aggressive techniques to release those fascial adhesions.